And it's not only the physician to Sahatna will make that information available to you as a patient.
And that's something that I was really interested in when you gave you the background of Sahatna in the first place. We talk a lot about the democratisation of healthcare data and the fact that the owner of our healthcare data should be us. And yet so often it's owned by the system. But what you've done with Sahatna is you've taken that data centrally into Malafi and then made it available back to the individual. So could I take my Sahatna app, for example, if I'm on holiday in New York or England or wherever, and say, I've got the problem, I've got an issue, I need to see a physician. There you go. There is my medical record.
100%. Then the whole idea of it, you have everything on your smartphone, right?
Welcome to Health Beats, another edition of one of the world's leading international healthcare podcasts with me, Steve Gardner, Managing Director of Healthcare World Magazine. We're brought to you in association with Abu Dhabi Global Healthcare Week, where we find ourselves in the studio. If you could see that way, which you can't, the exhibition is in full flight. We're on day 2. It's been a fantastic experience so far. If you can't be here, though, the next best thing is to subscribe to Health Beats, which you'll find on Apple Podcasts, Spotify, and all the usual podcast outlets. So if you haven't subscribed already, why not? We've had some brilliant guests already this week, and I've got another one with me here right now. Marius, you're going to have to tell me your surname and how to pronounce it.
Raileanu. It's a difficult one.
Raileanu, yeah. It's not. I've spent the week actually learning to pronounce Arabic surnames. To come up with a Romanian one has been a bit of a challenge. So you are the Chief Data and AI Officer for Sahatna, for the Department of Health. Tell us what Sahatna is and how it came about.
Sahatna is a digital front-door application. It's a patient application in Abu Dhabi. So if you're a resident in Abu Dhabi, or even as a tourist, for just visiting around, you can access Sahatna. You find it on Google Store or App Store. It's the place where any big healthcare is available. You want to make an booking for an appointment, you can go to Sahatna. You want to see your medical history, you can go to Sahatna. You want to see your prescriptions, like what medicine you take, when do you take it, and so on, you can go to Sahatna. So it's a product very close to our Department of Health, because Alpha, it's one of the first one worldwide at this scale, right? And Sahatna would not also, of course, be possible with the foundation which exists in Abu Dhabi, right? We're fortunate enough to have a strong foundation at Malafi, which is our HIE, right? Which you go to Abu Dhabi to any facility, right? You do a test, you just have a visit, anything, right? It's available and centralized into Malafi, which means my file. Funny enough, right? It's another equal. And that, of course, empowers us to build Sahatna on top of it and many other digital.
Because that's the bit that really interests me, is the way the data flows in. Because at the end of the day, we spend a lot of time talking about healthcare data, about how it flows and how it's shared. Explain for our audience, if you would, Malafi. So it's a single health information exchange, a single point of truth for the healthcare records of everybody in Abu Dhabi.
That's correct. Yeah, and that's really powerful. It was launched 2019, I'm not wrong, and today we have 100% of the facilities in Abu Dhabi on Malafi. Even if you want to open a new facility in Abu Dhabi, right, as a provider, you have to connect to Malafi, right? So you can have your own EMRs and so on. You just have to integrate and send all the data to Malafi, right?
And that's presuming you're on the use of an API.
Exactly. That is like data interoperability, with which some people HRS7, those do say fire HRS7, right, to send all of this information to a central system. And the main reason we do it in the end, like the benefit is obvious, right? Everyone has access to the data. Even it's a benefit for physicians, because if you go to a facility, you do some lab tests or anything, right? Even if you go to a different facility to see a specialist or the follow-up, the physician will always have access to your full medical plan, right? And this is so critical. And it's not only the physician, to Sahatna will make that information available to you as a patient.
And that's something that I was really interested in when you gave you the background of Sahatna in the first place. We talk a lot about the democratisation of healthcare data and the fact that the owner of our healthcare data should be us. And yet so often it's owned by the system. But what you've done with Sahatna is you've taken that data centrally into Malafi and then made it available back to the individual. So could I take my Sahatna app, for example, if I'm on holiday in New York or England or wherever, and say, I've got the problem, I've got an issue, I need to see a physician. There you go. there is my medical rent.
100%. Then the whole idea of it, you have everything on your smartphone, right? And I think everyone today has at least one smartphone, right? And everything is available, regardless of you being on Android.
I mean, it's a complete aside to this conversation, but I never understand why people want more than one smartphone. One is enough. One is too many. But
I think it's the work and the personal thing, right? Sometimes maybe I have one and I find this the disadvantage is that I have one and sometimes I mix work with the personal, right? You don't know.
Talking of which, I think we have to make probably the most important point of this podcast, which is congratulations, because you've just become a dad. Is that right?
Yeah. But second time, thank you very much.
Yeah.
3 days ago. So yeah,
I thought you looked a little tired.
Exactly. Yeah. So I'm quite, dream about changing an office and so on. But very happy to be here. It's a huge event for Abu Dhabi. It's our second time, and it's really exciting. And
And I think we need to talk about how the health system here in Abu Dhabi works, because would something like Sahatna or even Malafi that sits behind it be possible anywhere else? How much of the development of the data strategy and then the ability to do something practically really quite outstanding and innovative with that data, how much of that has been made possible by the determination and the ambition of the Department of Health here in Abu Dhabi?
Look, I always have been in the region for over 10 years now. I'm come back from Romania. That is a heavy public health sector there, right? And if you think of it, like why they don't do it there, right? I would say it's always a big question. And for me, the answer is, I think the leadership vision here in UAE, right, and Abu Dhabi is something which very few countries worldwide are fortunate to have, right? So in my perspective, if you look at everything which have happened in the region for the last many, many years, right? We have G42, right? We have our sovereign cloud, which allow us to store risk data, spend data. We have Mohammed bin Zayed, investor of AI as well, right? AI focus in the vaccine, right? You have Emirate genomics program. Again, we're reaching soon 1 million genomic sequencing tasks.
Am I right in saying this is 100% of the indigenous population of Abu Dhabi have now had their genome sequenced? Is that correct?
I would probably have to check with the genomics team.
Yeah.
But that's the work for
it's certainly
now.
Close,
Yeah. And it's also now expanded even to expats as well, right? And this is, again, you have the phenotype data, right, in Malafi, right? You have now the genotype data to genomics, right? We have the claims data to something called Shaqaqiyya, right? All of this combined is really allowing us to increase health lives, right? Again, if you look at the whole Abu Dhabi Global Health Week is about longevity, right? How do we increase the healthy average life years of the population? And if you pick in Abu Dhabi, there are over 3 million, like 3.6 million people living here, right? If you just extend with 1 year, everyone life, right? That's already 3.6 million years, right? So it's the ambition and the foundation we have is going to allow us to execute at something like that. For me, this is incredible. And now we see everything happening worldwide, AI as well, right? Everyone is talking about AI agents, Gen AI, how this is going to change the world and so on. Now combine this data with the technology, with the cloud, with the sovereign cloud we have, with the AI, and I think you're really going to open the door to preventive care, right? I think healthcare is known as being a bit more reactive. And that's not a healthcare problem. It's also a people problem, right? We always go to the doctor when something's happening or something is wrong, which sometimes might be a bit too late, right? So how do we focus now at preventing part is the critical part.
It's moving away from reactive towards proactive healthcare, right? And I think it's really interesting in a lot of health economies, particularly those health economies that are led by insurance, how we pay for preventative care, how we create through preventative care. We talk about outcome-based payment models, we talk about value-based healthcare, but actually, where are the incentives to actually create preventative care? Can we ever move to a situation where you're contracting a healthcare provider on the basis of the number of people that don't come into the system? Do you think that that's possible?
I think anything is possible in fact of painful, right? Like if you look at car insurance, the way it works, it's similar, right? You do accidents, your premium goes up, right? I don't look, it's hard to see what's going to come, I would say, even more with AI coming into the picture. But for me, the end goal in the end is me as a person who will end up spending more time with my family, big health. I have the kids. My goal is how can I extend my life? I have being more healthy and focus on preventive. for me, that's in the end the end goal of it, the ideal way to
So creating health equity and making sure that everybody has access to the highest possible health
so
coverage in any system. And I guess the point here when we talk about preventative care and we talk about the ability to extend lives, all comes back to data, right? And how we use data to predict and project where the healthcare issues are for the population as a whole, but also right down to an individual level. You started the conversation talking about Sahatna as being the kind of front door, the digital front door, the triage tool, the ability to book appointments, to get to see your doctor. How does that flip around into ensuring that we're picking up health conditions often before the individual knows they have a health condition?
I love the question because, again, this is also very close to my fact, right? Is you have all of this data, right? Is how do you leverage AI actually to try to predict things before they happen, right? Which is going to allow you to prevent it, right? Specifically in mid-sex, and act. If they happen, how do you act, right? Which is a framework we're very passionate about, that department of that, right? We want to predict things using data and AI and technology. For example, I'm going to be able to, and would have today in production, all the physicians in Abu Dhabi that have access to patient risk profiles, right? So I'm going to be able to see for the patient what is the risk of developing diabetes or the risk of developing specific cancers. And I'm able to see that in advance. Like I said, this patient has a high risk to develop breast cancer, let's say, which then is going to allow you to try to prevent it. And I'm going to do screening. I'm going to keep a closer eye and try to help with them. And if they happen in the end, how do we find the best course of action? And this is a framework we're very passionate about, which is also the core of a new initiative we have released, which is a population health intelligence platform, which is going to allow us exactly to do this. How do we prevent, predict, and act? And the whole idea is, again, we have all the amazing data. We want to leverage the power of AI and create agents for every single thing. And it's all about how do I personalize care for you as an individual. But one thing I believe we're doing it best, like first in the world, is not about a lot of companies, like a lot of countries or places who take care of at the macro, right? That we're going to do a policy at an Emirate level or country. Some I do at the community. Some I do at an individual. We're trying to do with population health intelligence platform is we are trying to combine the three. So how do we take actions at the macro level, at the meso level, or the community/district level, and also at the person? Because you might be able to Sahatna, I might be able to recommend you to walk more. And if in the community, you even have a path to walk or anything, some might do it, but a lot of them won't do it. So how do we take actions at the community level? And how do we take actions at the Emirate level? It is very, very, very.
But there is a point here. There is a point here that needs to be challenged, which is that Abu Dhabi, and I don't know if you know off the top of your head what the population of Abu Dhabi is, but it's not a huge area. It's not a huge territory. And actually, the level of data required to give us accurate population health predictions is massive. Is that even at the brilliant level that you've created of having the health data and having access to the population data for everybody in this emirate, is that enough to allow us to be predictive, or do we need more data?
Look, I think data is always, look, I've been data my whole life, right? What I've seen is actually usually the opposite. We have data, but people don't really actually do anything, right? Do we have enough data? I think you can always have more data. And even with Sahatna now, we have a wellness module where we try to capture like sleeping patterns, activity, steps, everything right there. So we're going to expand a lot into that. We have the EGP, like I've mentioned, which is a new word by genomics. And I was actually reading like the sequence genomics 20 years ago was about 100 million for one sequencing. Today you need $1,000.
And it's also the amount of data storage required for a single gene.
Exactly.
We'd probably take a computer the size of this building for a single genome. You probably couldn't get it. So I'm not doubting for a moment the level of data and the level of deep data that you've got in the system. It's the volume that is the thing that concerns me. I know in the UK, for example, that we've, using an entire country, which I think is probably about 4 or 5 times, if not more, the size of Abu Dhabi. We've got the whole country's data. We've created situations where we've done the okay, the data tells us that if we do that, do this, we'll get that outcome, and then been wrong-footed by the outcome that we've got. And that's with a large volume of data. Is there a way of solving that
So
problem?
I think that the two angles to it, right? A lot of AI models are actually either trained in US or in Egypt, right? So one of the things is how do we get them and ground them on this region data, right? Yes, you have a lot of experts here. So if I look at Westerns, they might be representative with these models. But if you look at the Arab region, maybe there was not enough data. The models can not be trained for them. So I think, look, it's a balance, I would say. For experts, I do believe, look, in the end, we monitor always the accuracy of the models. And we see, look, if I tell somebody, look, if you have a high risk of diabetes, go do a test, check your blood sugar levels, we always try to see what's happening if they do. Did they have a high probability or not, right? And then you continuously improve your model. Another technique is something called synthetic data generation. And if you don't have enough data, usually what you do, either the quality might not be the best, like for whatever reason, the data have been there, some of the information is being missing. For example, somebody maybe have diabetes, but they're an expert, they came here, we didn't necessarily capture for how long they had diabetes or cancer, right? So that's missing. So what usually we do, we use synthetic data generation to complete that data. And ensure we have enough volume of data in order to make sure that the predictions and the models will have are accurate.
Because there's two paradigms here, aren't there? One is volume and the other is accuracy. I remember a good friend of mine once told me that data is like a lettuce. It's fantastic and it's crisp when it's fresh, but it goes off very quickly unless you put it in the fridge. Yeah. So from that point of view, maintaining that level of quality. But also that there's a third point here that I want just to probe out a little bit. And that is the fact that from a health system point of view, in order to create proper population level analytics, you don't just need the data that comes out of people's health records. Because having data from sick people is only giving you a proportion of the population, right? So again, how do you solve that problem?
So look, that's why what I briefly mentioned is Sahatna, we have the wellness part, right? Yeah, we try to capture more external data points as well, right? Like data which as a healthcare provider, maybe we never had access to. Like I wouldn't know your sleeping patterns, I wouldn't know your stress levels, I wouldn't know your activity levels and so on and so forth, right? But what we also do in Abu Dhabi, because again, it comes down to the strong leadership and the vision which is here, we have strong partners, right? So we partner, let's say, with community developments, trying to understand activities at a community level. We partner with education, ADEC, right? In the end, trying to understand what programs are running in schools and so on and so forth, right? We have environmental data, right? Air pollution and so on, which we know it's a challenge in the region as well. And how does that impact as well? We partner, we talk with other partners trying to understand spending behavior, right? Let's say, what do people in specific districts are buying, right? From a food perspective, is more like, fast food or healthy food and so on. So we try to combine all of this to ensure we get the right level of...
What you're talking about there ultimately is the social determinants of health.
Exactly.
And again, it takes that whole system, government-driven initiative in order to really understand those social determinants. You talk about payer models and insurance companies and healthcare providers and all the rest of it, but actually looking after the public health messaging, looking after people's activity levels, looking at levels of pollution, looking at what conditions they live in, all of that kind of stuff. Is that the level of data that you're crunching to put into these models?
That's exactly what is the foundation, what I call the foundation of our population health intelligence platform. And look, the reality is we don't try to target directly the end state, right? Ideally, we would want all of this data and much more.
Yeah.
But we are ready, I think we have a strong foundation to help us do things which were never done before worldwide, right? How do you do the right intervention at the right time, on the right channel, to the right person at the right level? Right? Do I have to make this intervention at the macro level because it's already a bigger problem and it's something we have to do at Emirate level? Do I have to do something at the personal level or do I want to do something at community level? I think we have enough already to trigger that. And look, I believe that when the moment the ball is rolling, more and more is going to come, right? More data is going to be generated, more partners are going to come on board in order to ensure we're going to succeed on this.
I want to put a statement to you that was made to be by a global healthcare expert who I interviewed a year or so ago, that it is an ethical requirement of humanity to share healthcare data. That actually, if we don't share our healthcare data as individuals, as systems, and as countries across borders and around the world, we're doing a disservice to the whole of humanity. Is that a statement you'd agree with?
I cannot agree more. And look, I've been working when I was on my time in Microsoft, I was advising different industries. And I always looked at, if I look at the retail as an industry, why do you need the customer's data? I want to upsell, I want to sell you more stuff. Maybe you don't need it, but the reality is my end goal is how do I make you spend more? I'm going to package it nice. Let's say I'm going to personalize, the thing you go to Carrefour, you buy something, I'm going to sell you something maybe you didn't plan to buy. And that's the end goal. So I need your data trying to do that. For me, healthcare, I believe, is probably the only industry worldwide where we need the people data. And the goal is nobody is trying to sell you more, right? If you think of it, yes, I'm trying to sell you more healthy life, yes, right? If you want to look from that angle. So for me, I'm fully on it. I'm also a data person, so I'm maybe a bit biased to it. But yes, for me, having all of this data and giving it the benefit is disproportionate, right? I would say.
I did a big interview with a cybersecurity expert a little while ago, and I upset him enormously. Because he started talking about cybersecurity around healthcare data. And I just said, why? Why do you need security around healthcare data? Why would somebody steal it? And what would they do with it? It's a really strange thought. So I guess from that point of view,
I do think it's important, right? I think you can keep a balance. Ensuring privacy is critical.
It's anonymization, isn't it? Anonymized data is the way forward.
Exactly. Anonymizing, de-identifying with anonymization of the data is important. But we also believe that, look, at UAH, right, that data is, like you said, a patient owns the data in the end, right? It's his own data. And we take that very seriously, right? So you always have to be in control, like, also your data, who is having access, ensuring that whoever accesses that data is somebody who actually should access it, like your physician, for example, right? And so on and so forth. So I do believe you can do both, right? That's why we went on sovereign cloud, where we have very stringent policies around the computers in place, right? And because, look, in the end, the last thing you want is your health record to be exposed. So you can do both, but I'm also a strong advocate of how do you capture more data for the data.
But this is the point, isn't it? Because actually, if every country went out and did what you've done in Abu Dhabi and mandated the sharing of healthcare data, then the data set that we would have globally would be so incredible. And we could really achieve the true potential of population health and precision medicine.
Yeah, look, the reality is with the way AI is progressing, right? I do believe we're going to get there. But it's also a challenge in terms of actually making all of that collaboration, if I try to use a non-technical word, like integration part, right? Of ensuring that all the data is shared in the right quality, we know at the right time, in the right format, and so on. There is a lot of discussion of interoperability, like FHIR format and so on, but it's not heavily adopted worldwide, right? Also, the challenge is to go and do an upgrade of an EMR is multi-year, sometimes an expensive process, right? To ensure it support that. So there's some challenges even to achieving that. Again, that's why it's incredible what was achieved here, because to get all the providers, regardless of your EMR, right, to do that is also very, very difficult, I would say.
Well, I'm very, very disappointed to tell you that we're out of time, which is a great shame, because two data geeks could probably get at this for another hour or two. Marius, it's been an absolute pleasure.
Thank you for having me. Yeah, thank you very much.
And thank you all for watching. Don't forget to subscribe to Health Beats, wherever you get your podcasts, for much more of this kind of thing. And I'm definitely having this man back on at some point in the near future. In the meantime, your wife called, your nappy needs changing.
I'm running. Thank you again.
Marius,
for having me.
Cheers.
Thank you.